Hi, and welcome back to the COVID Wellness Support Program. Today we're going to spend some time talking about pain, both physical and emotional pain, and how it presents in the body. The goals of today's session are to develop an understanding of pain in the body, both physical and emotion, and how it can relate to your operational stress injury. We're going to talk about some cycles of pain, both physical and emotion, and how it relates to functioning. And we're going to talk about a few strategies that we can use to help manage this pain, including things like relaxation, pacing, and closing the gate on pain signals. So we're going to start by talking a little bit more about physical pain. So in short, physical pain is an unpleasant sensation or emotional experience that arises due to the result of actual or potential tissue damage. And there's two types, right? We have acute pain. So this is the immediate pain, right? Maybe we break our arm. That's the immediate pain that we get from breaking our arm. Chronic pain, however, is pain that typically persists longer than it normally should, longer than the healing process should allow. This usually means greater than 3 months. So say we break our arm and we have the acute pain that goes through that. We're able to go through appropriate medical treatment and we get the arm repaired. However, we now have lingering pain as a result of this injury. So this would be considered chronic, especially if we're having it more than that 3-month duration. And this is where we'll start to see functional, psychological, and social concerns that can arise from the burden of dealing with chronic pain. And so why do we need to talk about pain? Well, approximately 1 in 5 Canadians actually reports having chronic pain. So it's a pretty common condition. But this prevalence rate increases dramatically when we see emotional concerns. So in the case of PTSD, 45 to 85% of individuals who present for treatment with PTSD also have chronic pain. And what we've looked at is often if pain is present, distress can be greater, avoidance is greater. All of this, right, we've talked about does not help facilitate greater recovery, and treatment takes longer and we see slower progress moving forward. So there is a cycle between pain and disability, but what's really interesting is that pain intensity does not equate to the level of disability that someone will experience. What's really interesting is the level of disability that somebody experiences as a result of their pain is actually more due to the level of distress that the pain causes the individual and the beliefs that are developed by the individual in result of their pain. So in this case, we have this wonderful cycle. So we have somebody develops pain, right? Or if we go back to the broken arm. So we now have chronic pain in this arm. So we can develop distress from it, right? It's upsetting to still have this pain that's persisting and it's getting in the way of our lives. And we can develop beliefs, right? And we can have maybe 2 different extremes here. We can have a belief of, yeah, I have pain, but it doesn't impact my life and I'm able to continue on, right? If somebody has this belief, you're probably going to see relatively low levels of disability, right? They're not really believing that their pain impacts their life, they're able to keep doing the things that they want to, and they're able to move on. They still have pain, but they're able to live accordingly. Alternately, we may see something like someone develops a belief that because of this pain, they are completely unable to take part in a bunch of regular things that they used to do, maybe sports, hobbies, socializing, right? They're essentially disabled from all of those previous activities. And so with that belief, right, that's where we'll start to see a greater level of disability. And what's really interesting is we can see this with the exact same condition and the exact same level of pain. It really comes down to what are the stress levels associated with that pain and what are the beliefs that are associated with that pain. There's a concept called pain catastrophizing, and this really has to do with things like ruminating about pain, so thinking about it over and over and over again, fearing the worst, so, basically being concerned that nothing's ever going to change, it's not going to get better, life's just going to be terrible because of this pain. And feeling helpless, right? So if we're feeling like we can't affect any change with our pain, it's a pretty helpless feeling. And when we see these different types of thought patterns, right, these beliefs that come up as a result of somebody's pain, this can really increase the disability that someone may experience due to their pain. Again, this is as opposed to the severity of their pain itself. Now, obviously these beliefs also have cognitive and emotional distress that's associated with them. And because of that, again, it just kind of fuels this cycle of this increased disability, right? The more barriers and the more challenges we're having to face, whether it's, just taking the physical pain for the face value that it is, or if we're compounding that with additional beliefs about disability, cognitive concerns, emotional concerns, right? It starts to get to be a much bigger and bigger issue, and it starts to become more and more difficult to manage. Thankfully, though, we've already talked about some of the skills that we can use to manage some, maybe non-helpful thinking patterns. We're also able to better manage learning skills to address some of the negative factors that are associated with pain and function better on a day-to-day basis to reduce that disability that we're seeing. So why is chronic pain so challenging, right? So many people feel that with modern medicine and what we have, they should be able to go in and be able to take a medication and be absolved of their pain. And unfortunately, this tends not to be the case. What we'll often see is somebody will experience an injury, say a broken arm. They'll experience that acute pain and they'll go and they'll seek medical care. And they'll get appropriate medical care for their acute pain. The issue is that when we start to see pain that persists past that 3-month mark and it becomes chronic, the medical system will try its very best to help them, but even with today's biggest pain medications, these pain medications tend to only reduce the pain by 30 to 40% in only about half of the individuals that are administered this medication. So, understandably, a lot of people get really frustrated with the healthcare system, right? They're looking for this help, and essentially the medical system is unable to give it to them. And because of that, they become dissatisfied with the healthcare system, and they end up with unmanaged chronic pain. This is kind of that helplessness feeling that we were just talking about. And so in this cycle, it becomes very clear that there's more than just a medical component to pain, right? There's other things that are going on, whether it's these thoughts, these emotions, these beliefs that are all tied into it. And so in order to manage pain, we really need to take this multidisciplinary approach. And so how are physical and emotional pain related? Well, first and foremost, physical pain may trigger upsetting or traumatic memories. So if you broke your arm in a car accident, per se, every time your arm hurts, you may be reminded again and again about this accident, and that can increase your levels of distress. The opposite way is also true, right? A lot of times when we're experiencing some of these really big, hard emotions, we can experience physical pain along with it, right? The idea of almost a tension headache, right? Where we're experiencing that chronic stress over a long period of time and then we develop a headache accordingly. That's our body physically reacting to the emotional pain that we are going through. A lot of times when people are dealing with chronic pain, a flare-up in any type of mood disorder can cause their body pain to flare as well. And current research is actually investigating a pathophysiological shared process that contributes to both chronic pain and post-traumatic stress, indicating that there's similar factors at play that are contributing both to the development and maintenance of both of these conditions. So really, these two go quite hand in hand. They also go hand in hand when we look at things like suffering. So unfortunately, pain in and of itself is part of life, right? Whether it's that we stub our toe or we go through a breakup, we experience both physical and emotional pain. It's part of life. What does not have to be part of our life is the level of suffering that we endure because of that pain. So there's a quote that says that pain is inevitable, but suffering is optional. And this is exactly true. We're going to talk about the pain cycle and the difference between a pain cycle that induces increased suffering and one that helps reduce that suffering and increase functionality in day-to-day life. But the suffering really comes from closing ourselves off to activities that we previously used to enjoy, withdrawing from many of our social and other enjoyable things in our lives, and increasing suffering through the development of things like depression and anxiety, being angry about what has happened, encountering relationship problems, sleep problems, deconditioning, on and on and on. So essentially this bubble of suffering can grow and grow and grow depending on how we cope with the pain that we have. So if we're talking about suffering, let's talk a little bit about this cycle that can contribute to it. So if we start with having pain, right? Often what we'll see is people will then become either inactive or overactive, right? Either they have so much, the pain is too severe and they have this belief that they can't do anything, so they don't do anything. Or we have individuals that say, oh, no, to heck with it, I'm just going to grit my teeth and I'm going to get through it and I'm going to, push myself, right? Kind of one of two directions here. Either way, we come back to the same point, which was we get increased fatigue and a lack of stamina. Either because we're working an injured area of our body too hard and we're increasing fatigue because it can't manage that, or we're not using it enough and we're experiencing deconditioning. So the cycle continues through deconditioning into pain with decreasing activity, right? So if we start to experience this deconditioning and we're learning that activity is painful in either regard, we're going to stop doing it, right? We're going to limit our activity because pain is going to occur with lower and lower levels of activity as our body deconditions. And if that's the case, if we're slowly less and less and less able to take part in some of these activities, we're going to start avoiding them, right? Like we talked about last time, we avoid things that bring us discomfort or distress. And so if it's painful to take part in some of these activities, we withdraw from doing them. This can also cause things like sleep difficulties, right? If we're experiencing this pain, it can be difficult to get comfortable, but we also talked about the fact that pain can interfere in of itself with getting that good quality sleep. We're not doing activity during the day because of our pain, so we're not putting money into that sleep bank or building that sleep drive as we want, so we're not getting that good quality sleep. And as we know from talking about sleep before, these sleep difficulties can result in things like decreased stress tolerance, low mood, increased frustration, all of these things that can perpetuate this cycle of distress, which as we know, then it can impede sleep in of itself. But it also can increase those negative thinking patterns that we see. Remember, we talked about how those automatic thoughts tend to be quite negative and they tend to show up a lot more when we're experiencing things like depression and anxiety. And because we're having all these negative thoughts, now it's compounding with our pain. It starts to become really hard to manage everything, and so we start to withdraw, right? Whether it's we're working less, we're engaging in less social activity, our parental responsibilities, whatever it is, we start doing less and less because it's harder and harder to maintain. And then this cycle brings us all the way back to our pain again, and we continue through this cycle again and again. And I'm sure you can readily see just how much suffering is going on for the individual that is going through this cycle, right? And you can see very easily how this person might become feeling helpless and hopeless in relation to their pain. Thankfully, there are other options and ways of coping with this, which we're going to talk about in a moment, but I also want to chat a little bit about the emotional pain cycle and what we see. So, what does stress do to the body, right? When we have these increased periods of stress, it's important to notice what this looks like. So when we have short-term stress, right, our body essentially reacts accordingly. So we start to get some feelings of stress, our heart rate increases, our breathing increases, right? We're essentially getting the body ready to go, right? We're getting into a bit of that hyperarousal state. Our body is gearing up for that fight, flight, or freeze because it's experiencing that stress. It's doing what it's designed to do. And if this is just a brief thing, right, we encounter this, our body gets elevated, it gets into this hyperarousal state, and then it comes back out of it. The trick becomes if we experience these prolonged times of stress, like right now, our body stays on all of the time. And our body was not meant to do this, right? It's actually very challenging for it to do so. And because of that, we'll start to see greater, more severe problems. So things like if we're constantly worrying about stress, we can develop things like mood disorders, anxiety, PTSD, all of that. We can see things like heart conditions, right? If our heart is working overtime all of the time, we can see the development of heart conditions. We can have trouble with our breathing, right? So if we're constantly breathing heavily or shallowly, this can lead to increased feelings of anxiety and panic, and so on. We start to see these longer-term, more chronic conditions evolving. Now, thankfully, there is a different way that we are able to manage both these physical and emotional pains in a more adaptive way that we can reduce that suffering. So here you'll see the same cycle that we just talked about with some very key distinct differences as we go through. So again, we're going to start with the same pain, right? We have this chronic pain in our arm because we broke it and it, has lingered afterwards. But instead of either becoming inactive or overly active, in this case, we're going to focus on activity pacing. And we're going to talk about what this is in more detail in just a moment here. But essentially, we're going to pace our activity according to our injury so that we're able to maintain it in a nice threshold, basically, where it's not going to make things any worse, but we're still able to remain active. And because we're able to stay active and continue to do some of the things that we enjoy doing, we're going to experience increased energy, right? We're doing the things we enjoy doing. It feels good. We've got more energy for those things. And because we've got that energy, we're able to actually maintain some of our physical fitness and some of our social things, and we're able to maintain more of our medical and physical interventions that are designed to help reduce our pain. And because we're able to still take part in life, we have these reduced perceptions of our pain, right? Those beliefs that we're totally disabled start to minimize, right? Because we're showing ourselves, hey, we actually can keep doing all of this. I can keep taking part in regular activity or socializing. And because we have confidence in our ability to take part in these activities, we tend to avoid them a lot less, right? We're actually eager to maybe go and do some of these activities. With that improved activity, we see that increased sleep drive, right? So we're putting more money into that sleep bank. We're able to buy that good quality sleep at the end of the night and get that restorative rest. This results in increased mood and positivity and motivation. And that means that we don't see as many of these negative thoughts pop up. And when they do, we're able to challenge them like we practiced doing before. This lets us stay involved in the activities that we value doing. And while this, yes, leads us back to our pain, we still have our pain in the same condition that we had as before. But in this case, you can see that the suffering that this person is enduring is much less, right? Rather than having all these compounding issues, withdrawing from life, activities, increased mental health concerns, decreased sleep, on and on and on, we're seeing somebody who is able to cope with their pain, adapt accordingly, and still live quite a fulfilling life. So how can we do this? We have some strategies to help with pain in the body. So first of all, we can work on relaxation, right? So especially during these periods of prolonged stress, like we were just talking about, our body tends to stay activated all the time. We need to remind our body that it is actually safe to relax and calm itself so that we don't run into some of those health concerns that come up from these prolonged periods of stress. So we've done a few relaxation exercises already. I encourage you to use any of those. You can use the regular breathing, whether it's guided imagery, whatever it is, I just want you to work on relaxing. We're going to go through another one that is specifically geared to relaxing the body today as well. Then we can do things like pacing, again, which we're going to get into in a moment, which is optimizing your activity level dependent on what your body is actually able to do. So we're not underperforming and we're not pushing our body too far. And we can use the gate control theory, which helps weaken the pain signals that actually make it to your brain. And again, we're going to talk about that in more detail here in just a moment. So strategy 1, relaxing, right? So we talked about this already. We've done the diaphragmatic breathing. We've used imagery. We're going to do the progressive muscle relaxation today together. And I'd encourage you to use some of these mindfulness techniques. If you remember, we talked about having this glass of water, right? And if we have this glass of water and it's full because we're thinking of all the things that we had to do, yesterday, we're worried about maybe something we did yesterday, we're thinking about the things we have to do today, and we're concerned about maybe something that's coming up next week, this glass of water is really full. And because it's really full, we're tense, right? It brings that increased distress because we're trying not to spill anything that's in this glass. Mindfulness techniques and strategies help to reduce the amount of water that's in that glass. So we don't need to stress so much about trying not to spill because we've got quite a bit of wiggle room and we know that that water isn't going to go over the edge. So I'd encourage you to engage in any mindfulness activities that help bring you back into the present moment. Some of the grounding techniques that we've talked about and breathing can be really helpful for this, using the 5-4-3-2-1 technique to bring yourself back into this present moment. And what this allows for reduced emotional pain, so our body relaxes because we're not in that heightened period of distress, which allows our muscles and our body to relax, which helps reduce that physical pain. Now, in terms of relaxation and the nervous system, right, we have these two counterparts. We have the parasympathetic nervous system and the sympathetic nervous system. So the sympathetic nervous system is really that fight or flight or freeze response, and it's getting the body ready to go. So things like our vision becomes more precise, our heart rate increases, our breathing increases, our stomach slows down digesting, right? Our muscles tense, we're ready to go. The parasympathetic nervous system is the opposite of that, and that is the system that we are actually trying to activate by doing all of these strategies. This is the one where we are able to relax, so our breathing becomes easier, our heart rate slows, we're able to digest what we've put into our body, our muscles are more relaxed. And in this case, we really want to make sure that we're able to activate that parasympathetic nervous system in times of prolonged stress, to give our body that physical break from being on all of the time. Now, one of the ways we can do this is by using a progressive muscle relaxation. So a lot of times, right, when we're in that sympathetic fight or flight response, our body is quite tense. And we're able to actually systematically go through our different muscle groups and tense and relax them and release that energy, so we're able to calm the body by physically showing it that it's okay to relax right now. And as with most relaxation strategies, we're going to continue to do our diaphragmatic breathing all the way through it to, again, add another level of reminding the body that we are calm and we are safe right now. It is very effective for things like stress and managing symptoms of pain, insomnia, and headaches. So any of this falls into what's going on for you right now, I'd really encourage you to take part. Now we're going to come right back to that. I'm going to finish talking about the other strategies first here. The next one is activity pacing. So we mentioned this in passing is the concept that we want to maintain activity at a level that our body can actually continue to do. So what we'll often see with people with either chronic or emotional pain is we do way too much and we injure ourselves and then we can't do anything. Kind of this boom-bust cycle. So a great example of this is somebody that decides they're going to start working out. Maybe they haven't worked out in, years, and they've decided they're going to work out, and they go to the gym, and they work out for 2 hours at the gym. They go all out. They work out as hard as they possibly can. Well, understandably, and I'm sure most of you have probably experienced this, where you wake up the next day, and your muscles are hard as rocks, and they hurt, and your body is all inflamed, right? The odds of you getting back to the gym the next day are probably pretty slim. Right? We've overdone it. And so because we've overdone it, now we have to hit this period where we can't do anything, right? Our body's in pain. We can't get back to the gym. But then the issue that we'll see sometimes is as soon as somebody's able, they go right back and they do another 2 hours at the gym. And then because of that, they hit the same bust cycle, right? It comes down, they hurt, they can't go back to the gym again. So we see this with a variety of different physical and emotional pain situations as well, where we do too much and then we can't do anything. So instead of following this boom-bust cycle, we want to do something called graduated activity. And this is an alternative to the boom-bust cycle where we start with a relatively low level of activity and slowly build from there, right? So the goal is to start by finding an amount of activity that does not aggravate your pain, right? We're going to start with a relatively low level that we're able to do consistently over a span of approximately 2 weeks. And then we're going to continue building a little bit and a little bit and a little bit from there. And what you're going to see is that over time, your activity tolerance actually increases, right? Much more than we do in that boom and bust system. We do this in a safe way, in a way that's adaptive for our bodies. So how do you do this? Well, the slogan is start low and go slow. So we want to pick an activity that does not increase our pain, okay? So we're going to choose an activity, let's say walking. And let's say typically you can walk 5 blocks before your pain condition kicks in, okay? This is a hypothetical situation. In this case, we're actually going to start even lower, right? So if we're going to start doing this regularly, instead of walking 5 blocks, maybe we walk 2 or 3. And we're going to do 2 or 3 blocks every day, provided that we don't get any pain. And if we do that for 2 weeks without any pain, then we can start to build. Then we do 4, then we do 5. But the idea is to find a baseline, find an area that we're able to consistently do an activity without pain, and start there for a prolonged period, and then slowly build on top of it. And what this does is it helps you gradually increase your ability to take part in these activities without flaring that pain, without bringing on additional undue emotional distress that goes along with it, helps reduce that suffering and increase our ability to cope. So some other ideas for pacing is build in breaks. Okay, even if you feel like you don't need them, if you're going for this walk and there's a bench that you know of, maybe plan every time you go on this walk to sit at that bench for 5 minutes before continuing on. You can take mini breaks. This is really great for cognitive and emotional pain, right? So if you're at work, take a mini break. If something's going to be really challenging for you, build yourself in chunks where you're able to take a moment away, where you can rest and come back to it. We don't want to go too far. We don't want to overexert because that just increases our distress and decreases our functioning. Saying no to unreasonable or unmanageable requests and negotiating a manageable division of labor. So this is really important, especially within the healthcare setting where you might be being asked to do things that are well above and beyond what your physical abilities actually are. So make sure that you're speaking up for your own physical abilities and not pushing something too far and risking further injury or greater distress. Make sure you're asking for help. And lastly, distinguish things like priorities from preferences. So sometimes people will hold themselves to these really high standards, right? Oh, well, I should be able to move this patient by myself, so I'm just going to do it, right? That should be able to. Not I can or not I am able to, right? So watch what you're holding yourself to in that situation, right? Making sure that you are asking for help if you know that that's reasonably something your body cannot do at this point in time or should not do at this point in time. Slow down. Make sure you're doing one thing at a time, right? When you're engaging in paced activity, we don't want to do everything all at once. We want to focus on one activity and make sure we're doing it well. Take breaks, do pieces of a larger job in segments. Just break it up so that it's more manageable for yourself. And choose to simplify your life, right? So if you have a lot of maybe yard work to do, right? If you're able, maybe get some assistance with it. Or maybe this is something that, again, we break up into chunks, right? Can we simplify this? Can we make this easier? Can we maybe get rid of some things, right? If we're constantly tidying up and organizing stuff, do we maybe need all of those things? Trying to simplify our lives so that it's easier and we don't have to go into situations that might aggravate our pain as much as we regularly might. I'd encourage you to think of maybe some other ideas of how pacing might apply to you. Think of your job and your workplace. Think of your maybe parental or family requirements, social requirements, and see where you might have a better opportunity to pace your own activity to, again, minimize that distress in order to increase our overall functioning. Now, the last strategy here that we're going to talk about is closing the gate on pain signals. So when we experience pain, right? So say I stub my toe, okay? If I stub my toe, the pain actually travels up through our nervous system and into our brain, okay? Now, what we're trying to do with closing the gate is we're actually trying to basically shut that system down. So between the toe and our brain, we're essentially trying to close the gate. We're trying to put a blockade in there so that pain signal doesn't actually make it all the way up to our brain. And there's a variety of different things that can open this pain gate, that keep it open so that we get that pain registered in our brain. The first is our physical factors, so the extent of the injury, right? So if we have a really severe injury, it's going to be really hard to close that pain gate. As well as things like an inappropriate activity level, right? So if we're pushing ourselves way too hard activity-wise, that gate is going to be wide open. Our brain is very receptive to these pain responses. Things like emotional distress can also increase how much pain actually gets through and makes it all the way into our brain. It gets really hard to self-regulate when we're experiencing emotional distress. And thoughts, right? So if we are constantly thinking about our pain or we're bored and we don't have anything else to think about, and non-adaptive attitudes, so this belief that maybe we are very disabled, and if we, unless we actually are, if we're very, very disabled or we're unable to take part in all of our regular life activities, right? These big negative thoughts, okay? All of those can open up this pain pathway. Now, there are a variety of things, though, that can help close it, right? So help reduce the amount of pain signals that actually get all the way to our brain. First and foremost are things like medication, right? Medication helps to close this pain gate, helps keep those pain signals from actually reaching our brain so we don't actually register that we're having it. Things like maintaining an appropriate activity level, rest, and other things like counter stimulations. If you hit your funny bone, you can rub it and it helps it not be so painful. That's counter stimulation. So if we're able to give the body something else, a different sensation that's not painful to pay attention to, this can actually override the pain signal, and it will get to the brain and tell the brain that we're actually just experiencing this rubbing sensation on our elbow, not pain. We can do things to help reduce our emotional distress. So bringing in that relaxation, doing more of the grounding practices that we talked about, and managing our thoughts, right? So increasing our thoughts about what we enjoy in life, paying more attention to those types of things, adopting more adaptive attitudes, right? We talked about that with the pain cycle, going through a more adaptive pain cycle so that we're able to reduce that suffering. So overall, what did we learn today? Well, we talked about the fact that chronic pain can be associated with experiences of emotional pain and that they tend to overlap quite a bit. We learned that it's often the beliefs that we have about physical and emotional pain that actually are responsible for the amount of disability that we experience from them. And it's a combination of psychological, physical, and medical strategies that we really need to help reduce the secondary suffering from physical and emotional pain. So now we're going to go through the progressive muscle relaxation skill together. And like any new skill, this takes practice and it might feel a little bit bumpy to begin with. It typically takes about 15 to 20 minutes, although you can make it shorter if need be, and you're welcome to do this in an individual practice if you like after we've gone through it. One thing that I really want to flag with this is to be mindful of your body as we go through this. Okay, so if you are somebody who's recovering from an injury or a surgery right now, or if you have a chronic health condition, including pain or cardiovascular conditions, right, I want you to really pay attention to your body. And if this doesn't feel like it's going to be the right activity for you, please feel free to not do so. That's okay. You can engage in other types of relaxation activities. As well as we're going through this, we're going to be tensing and then releasing different muscle groups at a time. So if there's a particular area of your body that's giving you a significant amount of pain right now, feel free to skip it in this, right? You don't need to do it. You can just relax and just focus on your breathing while we do that section and then move on from there. Really, it boils down to just doing what feels right for your body and what's going to be safe for you at this point in time. Let's practice it now. Okay, so for this progressive muscle relaxation, you can do this from either a seated or a laying down position, whatever is going to feel nicest to you right now. So wherever you are, get comfortable, take a moment, feel free to pause this video while you do so. Once you get there and you're comfortable, I would like you to close your eyes and focus on your breathing. Notice how your abdomen rises and falls with each breath, bringing attention to trying to slow and deepen that breath, really trying to smooth out, especially those exhales. Spend a couple minutes here just breathing. Practice the paced breathing that we've done by breathing into a count of 3, 4, or 5, whatever feels right to you, pausing, and then breathing out to a count of 3, 4, or 5. On your next breath in, I want you to take a slow, long, deep breath all the way down into your stomach. Really notice it fill your stomach, and then allow your breath to carry away all the stress and tension out of your body as it leaves. Take another one of these slow breaths in through your nose all the way down into your abdomen. And release all that stress and tension as you breathe back out. One more of these all the way in into the abdomen. Releasing all that stress and tension as you let it go. Notice in this moment that your body has already begun to undergo a change. The tension in your body has started to loosen, and you've started to be able to relax. You can now let your breathing return to a normal rhythm and just relax where you are. As a reminder, I'm going to be starting to ask you to tense and then loosen different parts of your body. As we go through this, if there's an area of your body that doesn't feel good to do this tension to work with, feel free to skip it. Just focus on your breathing and join us again when you can. First, I'd like you to bring your awareness to your feet and your toes. Breathe in deeply through your nose, and as you do, gradually curl your toes down and tense the muscle in your sides of your feet. Hold your breath for a couple seconds and then release as you breathe out. Feel the tension in your feet just wash away as you exhale. Notice how different your feet feel from when they are tensed and when they are relaxed. We're going to do this one more time, and paying attention to tensing the soles of your feet. Curl your toes under. Tense, tense, tense. And then breathe out and let it go. Notice yourself feeling more and more relaxed as you continue to breathe here. Your whole body is just becoming heavier and softer and more relaxed as each moment passes. Now bring your attention to your lower legs, to your calf muscles. And as you draw in a nice deep breath, point your toes upwards towards your knees and tighten the calf muscles. Hold for just a moment, breathe out, and let it go limp as you exhale. We're going to repeat this one more time. You're going to breathe in, point your toes up towards your knees, tense those calf muscles, hold for just a moment, and breathe out and release. Feel the tension leaving those legs as you breathe out. In a moment, you're going to tense the muscles on the front of your thighs. If you're laying down, you can do this by trying to straighten your legs, and you'll feel the muscles pulling your kneecap upwards. If you're seated, you can tense these muscles by pushing your heels down into the floor. So take a deep breath, tense the muscles in your thighs, hold for just a moment, and then release as you breathe out. As you do this, the blood flow to these muscles actually increases. You may notice a slight warm or tingling sensation, especially with some of these bigger muscle groups. Enjoy this feeling of relaxation in your thighs. We're going to do the thighs one more time. On your next breath in, tighten your thigh muscles. Hold for a moment and release, breathing out as you do so. Notice them relaxing completely in this moment. Now we're going to move on to our glutes or our buttocks. And in this case, I'm going to get you to tighten them as you breathe in. You might sit up taller in your seat, hold for a few seconds, and then let it go as you breathe out. Notice yourself sinking further into the bed or into the chair that you're in as you release. Do this one more time, tensing those glutes as you breathe in, holding for a moment, and releasing as you breathe out. This time, on the next breath in, you're gradually going to tighten all the muscles in your legs, from your feet all the way up to your glutes. Do this in whatever way feels the most comfortable to you. So breathe in, tighten those leg muscles, hold, and breathe out and release. Notice how relaxed all of these big, strong muscles now feel. How heavy they are now that they're relaxed. We're going to continue to move upwards. I'd like you to bring awareness to your stomach. Draw in a nice deep breath and tighten the muscles in your stomach. Imagine you're trying to touch your belly button to your spine. Hold for a moment and release. We're going to do this one more time. Remember, belly button to spine if it feels good. Breathe in, tense, hold, and relax. Now I'm going to get you to bring awareness to the muscles in your back. Again, this is where we start to see maybe more chronic back pain. So if this is a spot of concern for you, feel free to just skip this and continue just breathing. But if it feels okay and you're wanting to, on your next slow breath in, arch your back slightly and tighten these muscles. Hold and release with your next breath out. We're going to do this one more time. You're going to breathe in, slightly arch your back, tense your muscles, and then breathe out and release. Now, continuing up the body, I'm going to get you to bring your attention to your shoulders and all the muscles in your neck. As you slowly draw in the next nice deep breath, I'm going to get you to pull your shoulders up towards your ears. Squeeze these muscles firmly. Breathe out and let them all go. One more time. We're going to breathe in, bring the shoulders all the way up to the ears. Hold for a moment and release and breathe out. Just feel that tension roll off of you as you relax. Feel the heaviness that's in your body now. We've now relaxed most of the big muscles in our body. They're feeling relaxed and heavy. Notice yourself being heavier in your chair or on your bed. Noticing this deep feeling of relaxation. You are calm and you are at peace in this moment. Now we're going to focus on the arms and your hands. So we're going to start with the upper arms. And as you breathe in, raise your wrists towards your shoulders and tighten the muscles in your upper arms. Hold that breath and that contraction for just a moment, and then release all the way down. You may feel kind of a warm, tingly, burning sensation in these muscles as you tighten them. Notice how relaxing it is to let that go. We're going to do this one more time with your next breath in. Breathe in, curl those arms up towards your shoulders, tense for a moment, and breathe out and let it go. Now bring your attention to your forearms, and as you breathe in, curl your hands inwards as if you're trying to touch the inside of your elbow with your fingertips. This will tense your forearms, hold for a moment, and release and let go. Again, one more time, we're going to breathe in, tense these forearm muscles, hold for a moment, breathe out and let it go. Feel the tension just washing away out of your forearms with that release. On your next breath in, I'm going to get you to tightly clench your fists. When you've finished breathing in, hold your fist in that position for just a moment and release, letting your hands go limp. Your next breath in, do the same thing, bring it in, tense your fists, hold for just a moment, and then release and let your hands go limp. You'll notice that your arms and your hands are feeling tired and relaxed at this point, feeling heavy as they sink either into the arms of your chair or maybe into the bed below you. Take a couple of nice, long, slow breaths here and just relax. Feel yourself slipping deeper and deeper into a complete state of rest. And last, we're going to work through our face. And we're going to tighten the muscles in our face by squeezing our eyes shut and clenching your lips together. So breathe in, clench your eyes and your lips together. Hold for a moment and release and let go. Allow your mouth to gently close. And again, on your next inhale, I'm going to get you to scrunch up your face. Hold for a moment and release, letting it go. Notice your mouth relax, your jaw relax. Any stress around your eyes is gone. You're going to take a big breath in and out here. Notice now how relaxed your body is from the very tip of your toes all the way to the top of your head. And take a few minutes just to enjoy this rest. Listen to the sound of your own breathing and enjoy the lovely warm sensation that all of this work has done. Now, if you like, feel free to just pause this video and enjoy this moment of rest. Otherwise, I'll get you to return your attention back to your breath. With each breath in, feeling that you're bringing energy back into your body. You can wiggle your fingertips and your toes to remind your body to slowly start waking back up again. Noticing how calm and relaxed and rejuvenated you feel at this point in time. Knowing that you can bring that with you for the rest of your day. And as you're ready, I'll get you to open your eyes and come back to us here. So if you're rejoining us from having done the progressive muscle relaxation, I want you just to reflect on how the tensing and releasing felt for you. Were there any areas of your body that you noted more tension, that maybe needed some more work? Were there any areas that maybe didn't feel so good that we're going to avoid moving forward, that we're not going to tense moving forward? How well did this strategy work for you in comparison to maybe some of the other relaxation strategies that we've tried? And regardless of which one is going to work best for you, I do encourage you to continue to try practicing this strategy. Like I said, it's a new skill, so it's going to feel maybe a bit bumpy and awkward to begin with. But this one is really helpful during these periods of prolonged stress, especially like what we're currently going through, to help relax everything in the body, bring down that sympathetic nervous system and activate your parasympathetic nervous system to restore and rejuvenate the body. So try practicing this as you're able over the next week and see how it monitors and changes your body. So as much as I'm encouraging you to continue to take part in and practice the progressive muscle relaxation, there were a variety of different strategies that we talked about today and that can help manage pain, both emotional and physical, and decrease suffering in our day-to-day lives. And so really, what it all boils down to is I'd love it if you could pick even just one thing out of today that you think could be helpful for you in your day-to-day life and start bringing it in. Whether it's something like activity pacing or starting to think more about the gate theory of pain and how we can bring in some different strategies to close that gate, whether it's a counter sensation, we're going to rub it, or we're going to manage some of our own emotional distress. Pick something that feels right for you and start implementing it. Again, the more that we practice, the better that it's going to become for us, the skill, and the more readily we're going to be able to use it as we need it. So continue practicing, keep up the great work, and we'll chat soon. Thanks.